Yes, welcome to the Teabba Radio Network. It is about that time of the week, time of the day, on the show where we speak to extraordinary audiologist, a family member to Teabba Radio. Mr. Salimon Joseph, how are you today? How was your weekend?
Excellent, Brendon. Excellent. Okay, how was your weekend?
Nice and slow, nice and quiet, lots of sleeping.
Very good.
All right. Okay, so we do a regular segment every week in which we talk about all subjects related to ear health. So you've decided to talk about something very important this week. That is
Microsuction.
Microsuction.
Because a lot of people now, they are aware about a technology called microsuction to remove wax or foreign body from the ear. And traditionally, once upon a time, a lot of people used to do cotton buds to push the wax further. What it does is it pushes the wax further into the ear canal. Okay, when we think about the model of the ear, so what the cotton bud does is it pushes the wax further in. The wax generation happens at the cartilaginous part of the ear canal at the entrance. So the ear wax has got a couple of useful purposes. Okay, it makes the microorganisms to kill. Okay, it is acidic in nature, 4 to 5 pH value, positive pH value, and it makes the ear canal moist. And because it has got a water, the flies will not get into the ear canal and make their houses in the ear canal. So there are
very interesting.
Yes, and but when people having too much wax, okay, a lot of tradies, as you know, they need to wear earplug to protect their hearing because they use those power tools, and any sound above 85 decibel is dangerous to our human hearing. So they have to wear ear protection. Sometimes it would be the outside of a headphone, but many times it's so easy for the earplug to use it and put it in the ear canal. So basically, while doing that, what they are doing is they are pushing the wax further into the ear canal. So when there is too much wax in the ear, people will get blocked feeling, and there will be hearing loss as well because of too much wax in the ear canal.
Yeah. So can I just mention that, yes, it is very important to have the earwax because it does serve a purpose.
Small amount.
Small
amount. When it is excessive, it is a problem.
And the second part of that question would be, the ear does actually clean itself and sometimes get rid of the wax out of the ear, but sometimes you need help.
Absolutely. Naturally, when the skin in the ear canal is intact and in very good condition, then naturally the wax will come out by itself. That is why we will see the wax in the concha. Yeah. When we take the shower, we will see a small amount of wax and we clean it.
Yeah.
But the problem in tropical climate, especially in Darwin, lot of people having otitis externa, the infection in the canal.
Okay.
When there is problem in the canal with the skin lesion and the dry skin, the wax will not come out by itself.
Okay, yeah.
Then we need an external help to take out the wax. The old method was when you go to a GP clinic, they will inject lukewarm water into the ear canal.
I remember that, yes.
And then, they will collect the wax. Okay, it takes time. It takes time to take out the wax. It may not be successful all the time, but there is a problem. The problem is many times when we look through the otoscope, the otoscope is the tool we use to look at the ear initially when a doctor or an audiologist come to the clinic. Okay, this is otoscope and there will be a speculum at the end. Okay, and we look
and that is the one with the light in it, so you can actually see into the ear canal.
Correct. Okay, there is a light, powerful light, and then we can adjust a focal point. We can adjust a focal point here. Okay, so depending upon the eyesight of the clinician. Okay, and the most important thing is we generally look at the good side. And then we look at the bad side, because we use the same speculum. Okay, there is another attachment here at the end of the otoscope. The main point is, if you look at the bad side with the otoscope using the speculum, and then we look at the good side, we are transferring microorganisms from the bad side to the good side.
All right, okay. And I just want to get back to self-cleaning of the ear canal, because we all do it. Sometimes the ear gets a bit itchy and we think, okay, yeah, a cotton bud, I'll be careful. And then sometimes you push a little bit too far and there is the danger of actually perforating the eardrum.
Absolutely.
So basically you're poking your
tympanic membrane.
Yeah, and that way, if you poke it too hard and it gets damaged, that is a really serious injury, isn't it?
That is why we adults, we should not, even if once in a while, if we just clean at the entrance of the ear canal with a cotton bud, we should not do it in front of our children.
Yeah.
Because we all learn habits, behaviors and language by mimicking other people.
Especially your parents, yeah.
Correct. Okay, so when the parent may not be there and the child will take this cotton bud and they will put it in the ear, at that time their sibling will come and make us, just a smash or something happen, then it will penetrate the tympanic membrane and there will be a hole in the eardrum.
And that's actually, known as the eardrum.
And the blood will ooze out from the ear canal.
Yeah.
If there is a hole in the eardrum.
And could that be fixable?
There is a surgery to fix it. But the problem is, after the perforation, when a child takes a shower, the water will get into the middle part of the ear. This is the outer part. This is the middle part and this is the inner part. The ear has got 3 parts, and when the water gets into the middle part of the ear, that will stay in the middle part of the ear, that will lead to an ear infection.
Wow.
And sometimes it will create pus generation and the pus will be oozing out from the ear canal. I have seen many ears in the community, the pus oozing out is so smelly pus.
Yeah. On that note, we're going to take a short break and then we'll be back with Mr. Salimon Joseph to talk about all things hearing. All right, so yeah, we'll just check that. That's okay. It is about that time of the week, that time of the day, on the show where we speak to extraordinary. Okay. Welcome back to the Teabba Radio Network. Thanks for your company on the program. Now, we are talking to Mr. Salimon Joseph. Now, he has come in because every week we do a segment regarding ear health. Now, on today's segment, we are talking about microsuction, but also basic ear care and maintenance, because we know that sometimes after a shower, a little bit of water gets in, and the first thing we reach for is a cotton bud, but we don't realise how dangerous that cotton bud could be. So, Mr. Joseph, microsuction, ear cleaning, how does that work?
Microsuction is nowadays the most efficient and effective way, or safest way to remove foreign body or wax from the ear. And the clinician, mainly ENT specialist and a trained audiologist does the microsuction. Someone need a proper training, and many years you have to do it to get a good grip of. And there are different tools. This is one of the tool, and if we have very hard wax, we have to use something else called a Jobson's horn to bring the wax out from the ear canal. We have to warn the client that there may be a little bit of bleeding from the ear, not from the tympanic membrane, because when the hard wax is hitting the ear canal, when you try to bring it out, there may be slight bleeding from the wall. So we have to inform the client. So basically, for microsuction, after looking at the ear, as I said, always look at the good side with the otoscope with the speculum, and then make an assessment, which side need microsuction. And then we need to have, the audiologist need to have, this is a microsuction machine, and so we have a sterilized microsuction, suction tip. This is a microsuction. There are different sizes, and then we need to connect this one at the end.
Okay, yep.
So, and then we need to just imagine, okay, we are doing it, okay, on the dummy. So through the light, you need to get a better understanding, and then you have to start the machine, the suction machine basically, and your hand need to be steady. There is no room for waving around.
Yeah.
Okay, and then you have to suck it out from the ear canal. So the procedure is very simple, effective, but you need to have 100% concentration in what you are doing.
Yeah.
Okay, so
and the patient needs to be perfectly still.
Absolutely right. Okay, adults much easier. They will be very still. But the children, I have taken wax out from a 2-year-old child. Okay, that was a minimum age. I have taken out wax from a child.
So at 2 years of age, under that you will not perform this.
It's very hard. Even the 2-year-old, I tell the parent, you need to hold the child firm.
Very still, yeah.
And then the head also need to be firm. Okay, still.
Yeah.
Then only, because sudden movement can get into, rupturing the tympanic membrane. We don't want any, bad effect with the microsuction. But majority of the time, the priority is to remove the wax, and the child need to hear very well.
Yeah.
Many times, currently many doctors are not doing it. General practitioners, they refer to an audiologist, trained audiologist or ENT specialist. As you know, in Darwin, to see an ENT consultant, the waiting time is 3 months plus.
Wow, I did not know that.
Yes, there are only 2 ENT consultants here in Darwin, and so the waiting time is too high.
Yeah.
And that is why the audiologist, why we learn the microsuction is when we fit hearing aid for a person with a hearing loss. Imagine when we put a BT hearing aid and the receiver is getting into the ear canal, and if the ear canal is filled with wax, full of wax for the client, how the sound will transfer through the ear canal to the inner part of the ear.
Yeah.
So we have to remove the wax before we put the hearing aid into the ear.
So also on a different note, because sometimes people out there might be thinking, okay, look, I'm having trouble with my hearing, and they might start thinking, thinking the worst, and all it might be is a simple case of just go and get your earwax cleaned out.
Absolutely. Whenever you feel, the people feel a blocked sensation, they need to approach someone who knows about ear health.
Yep.
And it can be a doctor or it can be an audiologist, because audiologists focus on their study, the 2-year master's program on ear. Ear is their specialty.
Yep.
So in Northern Territory, because I travel to most communities in Northern Territory since 2016 to 2023, I have seen many thousands of ears.
Right.
So when you see many thousands of ears, you get better understanding about what are the management, what is this condition, and when I need to refer to an ENT specialist, when I need to refer to an GP for medical management, all those things, that is the education of an audiologist, hearing specialist. We specialize in one particular area. Even a few days back, there was a call from a client. He went to an audiologist, and then he had a sudden hearing loss on one side.
Okay, that sounds scary.
And the audiologist suggested a hearing aid fitting, and just wrote a report, saying that it would be good to have an ENT appointment. And then for a second opinion, he contacted me, and then I told the client, I don't want to fit hearing aids straight away to you to make money for me, but the priority is you need to go to the emergency department of Darwin Hospital to see an urgent ENT consultation, because if the doctors start steroid medication, you may get the hearing back. Okay. That is a responsibility of a clinician. You have to direct the people at the right time. Don't make money out of people's disadvantage or difficulty. So you need to have some ethics, When you do some work, you need to have ethics,
Ethics, and I guess you need a good heart too.
Absolutely.
Yeah. It has been very interesting. And lastly, if you are experiencing maybe problems with your hearing, I suggest that don't think the worst first. Maybe just head along to your local clinic, your audiologist, get yourself checked out, and then get to the root of the problem instead of stressing yourself out and thinking the worst, which could also add more kind of anxiety to what's going on, to the situation.
Absolutely right. Okay, that is why if you have any concerns regarding ear health or hearing health, just go to Google and search Territory Hearing, and feel free to call me at any time of the day. 7 days. I am happy. If I am here, not taking my holiday, I am happy to answer. And if you leave a message, I am happy to call you back, and I will have a discussion with you. And I am happy to give a free advice.
This is the best man to actually see about your hearing. So just give people the number, please, if they were to give you a call, maybe.
The number is 0470216004 is the mobile number, or you can email to territoryhearing@gmail.com, or you can search the website www.territoryhearing.com.au.
Or they can ring us here at Teabba Radio and we'll pass on all your information.
Absolutely.
It's been an absolute pleasure as always. Thank you so much for taking the time to show people out there that, someone does actually really care with ethics about what's going on. So thank you.
Thank you very much, Brendon. It's a pleasure. Okay, always. Okay.
No worries. All right. You're on Teabba Radio, your voice in the bush. Thanks for your company.